If you really want to get involved in the nuts and bolts of organising, if you're planning a wrap and want us to try it out on this next week, then we have an organising meeting at Matthews Hall behind Charing Cross next Tuesday, Tuesday the 11th at 7:30. And anyone would be very welcome there. That's a planning and organising meeting. Something we have planned and organised, and which should be very enjoyable, is our Valentine's Day Hearts Around Charing Cross event. We'll be having that between 3 and 5 on Valentine's Day. I've often said, if this campaign could be won by baking, we could certainly have won, because there are likely to be so many shortbreads and cakes and curries and God knows what there, that come for a lovely feast as much as anything else. The next speaker, I'm sure most people know, he's been an active MP, a big inspiration in this campaign, and has been, like a terrier dog, getting into Jeremy Hunt's ankle about the Charing Cross Hammersmith local health services. So it's really good that Andy Slaughter could zoom across London and come forward.
Can you hear me? I'm about the right distance, fine, that's good. I feel seriously underqualified. Everybody else who's spoken has had the two letters DR in front of their name, which makes them still, to my mind, quite a godlike figure, whereas I've got two letters after my name that make people think I'm going to put my hand in the church plate. So I appreciate that. So I'll divert from that by talking about somebody even less well qualified than me, which is Jeremy Hunt. I'll explain why. We had a debate on A&E services in the House of Commons this afternoon. That itself is not unusual. We probably have one at least once a fortnight at the moment, and that's a tribute principally to Andy Burnham, who is terrier-like in pursuing this issue. The government never wants these debates, but whenever we get the opportunity and we have time, we, or indeed other parties, call those debates. So I had the opportunity, once again, to ask Mr Hunt a question, and this is what I said to him. I said, tonight at a Save Our Hospitals meeting in West London, I'll be speaking with A&E doctors and GPs about the largest ever closure programme. 4 NHS emergency departments that are closing West London. 8 West London MPs, including me, have asked the Secretary of State to meet us and discuss the issue. Shall I tell those who attend tonight's meeting the Secretary of State is still refusing to meet the 8 MPs who collectively represent nearly 1 million people in West London? To which, what I was referring to is a letter which Jeremy Hunt sent, we received it on the 21st of January, to my colleague Virendra Sharma, MP for Southall, refusing to meet those MPs. Quite unprecedented in my view. There's a convention that if constituency MPs on an important issue want to meet you, then the Secretary of State will do that. Hunt refused, and again today he said, I must follow a strict legal process in relation to such decisions, and we've had an extensive consultation. In fairness, let me say what he went on to say. This was his defence for the closure programmes. He said this: when he, that's me, talks to those MPs, he should tell them the facts about the proposals for North West London, which I approved. Proposals for 3 brand new hospitals in which 7-day working is to be introduced, 24/7 obstetrics, 16/7 paediatrics, 7-day opening of GP surgeries, and a range of other services which will help to address precisely the issues raised by Andy Burnham in the debate in connection with transforming out-of-hospital care. Now, if we take that at face value, then there are going to be new facilities built as a consequence of this proposal, and that some of those proposals... Right. Is that better? Okay, fine. If we take those range of services, some of which are primary care services, at face value, what was significant for me is what Hunt didn't say. He didn't address any of the points that Chris McGurk has addressed today. Points about capacity of the remaining hospitals, whether the A&E departments in West London that are less will be able to cope. Points about the distance of travel and the risk to health that's involved in that. And of course the points about the loss of the successful services and successful hospitals that we have, like Charing Cross Hospital. Even if even if all these things that he promised came to fruition, it still doesn't excuse the fact that the major emergency services in half of the hospitals in West London would be going and not being replaced. Now, but of course, we know, and again, this is from what John and what Louise has said, that there isn't any particular plan, no clear plan to replace those facilities with proper community and primary care. There is no plan. We are told that Hammersmith Hospital and no doubt Central Middlesex A&Es will be completely closed by this June. I mean, they've told us in terms that they were the only reason they're not closed already is they're worried about the winter crisis and they don't want to close them in the run-up to the local elections. So they will close a couple of weeks after the local elections. Those are the plans. And you're not telling me that the new community facilities will be in place by that time, because they certainly won't. But what's beginning to worry me even more is that every time we do get information out of Imperial or out of the local NHS, it's changed. And it has changed materially over the last year. The essential point hasn't changed. The A&Es are closing, the emergency services are going, the stroke unit is going to Charing Cross, the beds are being, emergency surgery beds are being lost. But what will be on those sites is changing almost week by week. So now, for example, rather than there only being 3% of Charing Cross used for NHS facilities, we're told it could be up to 50%. That will be a mixture of these primary care services, probably things like GPs moved from in the community onto the Charing Cross site. Some of the services that are there at the moment, such as radiotherapy, sexual health, mental health, staying on the site. Possibly the addition of some elective, i.e. planned low-level surgery taking place. So some beds, but only a fraction of the number of beds on the site there. Those are major and significant changes. They're not what we want, but they are changes. And yet at the moment there will be no consultation whatsoever in relation to those. And at the same time, just in case people were getting excited that things were getting better, they've now said they're going to sell 50% of the St Mary's site as well. So how is the extra capacity going to be built into the St Mary's site? And I wonder, having tried to work with a lot of the people involved in managing I don't mean to be disrespectful, at Imperial and in the NHS, whether they have the capacity to manage this change, whether they are able enough within the very short time frame they have. So even if you agreed, even if you believe what Hunt said, and even if you believe these changes were beneficial in some way, I don't think they have a clue how they're going to achieve this or how they're going to do that. And that seriously worries me, because they are, as John said, working to a very short timetable, because at the end of the day, this is about money. It is not about capacity or about quality in the health service, and that is what I find utterly, totally disgraceful. So where we are now, and yes, it is 18 months or more that we've been going, and I do mean going every week, week in, week out in relation to this. And we've won some battles and we've lost some battles in relation to this. But we have to move on to the next battle. And the next battle is now the local elections. Now, I agree with what John Grigg said. That I think the way that these matters are being dealt with, not just by the local council, but now by the NHS as well, is quite disgraceful. There is a lot of disinformation, a lot of wrong information. Some of that is downright scurrilous and libelous, and I've had myself to take legal advice in relation to claims that I oppose the opening of the stroke unit at Charing Cross. As a matter of public record, not only did I support the opening of the hyperacute stroke unit at Charing Cross, I tried to get the major surgery unit, which ended up going to St Mary's there as well. But because I have been accused of that and told that as a consequence of that, people are now alive who would have been dead if they followed me, I've had to take legal advice. It doesn't bother me, but what it does reveal is that if these people had decent arguments, they wouldn't be resorting to abuse, to libel, and to effectively propaganda, which is what is being put out day to day. But unfortunately, that's where we are. And indeed, the campaign itself, Save the Hospital campaign, and please let me just say, in relation to Anne, who's chairing tonight, but also to many of the people I see here, and many who, Vivian Luke, who aren't here tonight, but to people like Sandra, to people like Una, and to people like Desi, who, and I'm sorry, I should name everyone, for us to start naming people and say, but the courage and the absolute energy against all the brickbats that is thrown, of going out there in the cold every week and campaigning to save that, is the best campaign I've ever been involved in. I think this is great. I think the information is very clear and it's great. So I hope everybody who's here will help to get this out, will not just invent themselves, will get around the neighbours and talk to your neighbours, talk to the people who use hospitals. I don't think I've found more than 1 or 2 people out of the thousands I've talked to over the past 2 years who think that these are decent proposals. And you would think that would have got through into the thick skulls of the people who are pushing ahead regardless with all this. We are having another debate on this, if people who are interested, in Chiswick on the 15th, 12 o'clock at the George IV, I think, but if you've signed up for the newsletter, you'll get that information sent to you. And that is going to be a debate, but I think we should debate with the other side. Sometimes we need to explain what's going on because we don't have the resources. We have to explain by word of mouth or by leaflet. We don't have the resources that the Council of the NHS have. But to be fair, this is in Chiswick on the 15th. The MP for Chiswick, who is a government junior minister and who is supporting the proposals, and Mark Spencer are coming along to debate with us. So that should be quite a lively meeting. I think Anne is going to be speaking there as well. Noon at the George IV pub, opposite Waterstones in Chiswick High Road. That's being organised by people in Chiswick, but they also obviously use Charing Cross. It will be interesting, but at least they are debating. I can't have a debate with the people here because I'm afraid the Conservative politicians here, they simply want to use the resources of the council to spread disinformation. They're not prepared to come and stand up and do that way. So local elections will be important. You know where I stand in relation to how people vote. I'm not up for election myself. Louise is standing for a different party. We have had support from many parties locally. In some parts of London, even the Conservative Party is supporting pledges, not certainly here. But this is very clear. This is saying to people, we're not about party politics, we're about saving our health service. But this should be, to my mind, the key issue. Why is it important in local elections? It's important in local elections because if a majority of councillors, from whatever party, are opposed to the closures, no, they don't control health policy, but yes, they do control planning policy and building control and everything else that will dictate what is going on that site. And we know that if we can stop, or if we even just hold up for a year or two, those proposals to demolish the buildings at Charing Cross, to sell them off for luxury housing, refuse the demolition, refuse the planning consents for the luxury housing, which you see sprouting up everywhere across the borough now, that itself will be sufficient. So that's why it's not just giving a voice to people and a protest vote. It's an actual vote that can change and improve your life. I think, as always, I'm going on too long. We're going to have questions now, I think, which I'll be happy to answer if we can. So I just end by saying that I will carry on to Parliament and locally and doing everything I can. But this is a popular struggle. There is nothing as popular, and rightly so, in this country as the NHS. People need it, but they also love it and they care for it and they appreciate what people like Anne and Louise and Chris do for them every day. So that's why I'm delighted that we've heard primarily from the clinicians today. And we owe it to them, I think, to give them decent working conditions, to give them the resources to provide the services which we and our families all rely on. So let's give a round of applause for them.